I've touched a fair bit on exercise, but I just wanted to go a little bit more like where women maybe worry that they're doing too much or too little, like particularly like strength training and things like that. What is actually safe and what should we be avoiding when we're going to
sure. So I guess before you start treatment, it's really up to you what you want to be doing. And there's no real, I guess, guidelines on that beyond the 150 minutes a week. When we are doing a cycle, though, there is some pretty clear guidelines on what we should and shouldn't be doing. Regular activity is really important. So the whole idea of bed rest or, sit on the couch, don't do anything, you want to rest your body, that isn't really very helpful. We still want regular physical activity to still get the blood flowing. It helps with our hormones, it helps with our insulin sensitivity, it helps with our mental health, so all of those things. But we want it to be quite gentle. So we can kind of break it up into where you are in your cycle. So your, as I said before, baseline, pre-cycle, normal activity. What normal looks like for you is fine. During your stimulation part, so when you're using the FSH or the LH injections, light to moderate exercise. So walking, yoga, swimming, cycling, things like that. We're still trying to look for that 150 minutes a week. So 20 to 30 minutes most days is usually pretty doable. We want to try and avoid any running because the impact can be very uncomfortable, but it can actually cause problems with our ovaries. So there's something called ovarian torsion, which is like quite a serious injury that can happen to our ovaries. And when our ovaries are sort of overloaded with lots of follicles, you're at a much increased risk of that occurring. So things like running, twisting, or heavy lifting are the three things that we say to avoid. So heavy lifting, basically anything over 10 kilos. So I would be avoiding sort of like strength classes or really heavy sort of gym strength exercises, things like that. And twisting is the other one. So, I said Pilates, yoga, things like that. That's great. Just be gentle with your core stuff. So you don't want to be putting too much pressure through your core, basically. Then when we move on to our sort of that we've had our trigger and we're having the retrieval process, it's just rest and gentle mobility. So walking, we want to avoid things like swimming because of the risk of infection, especially after our retrieval. But yeah, still being active, but just really gentle. You kind of don't want to do any structured exercise because I tend to find people overdo it. That's fine, I'll do it. And really, it's only like a few days to a week that you need to just sort of take it easy. And walking is probably, the easiest and the best way of doing that. And it's really good for your mental health as well to sort of pop a podcast on and go for a walk. After we've had the retrieval, so it's, I mentioned no swimming, but it's also really important that we don't do any impact activity or any abdominal strain. So things like, planks, sit-ups, things like that. That just puts a lot of pressure on an already inflamed area. If we get any symptoms of ovarian hyperstimulation syndrome, so OHSS, which is pretty rare, but can occur especially if we've gotten heaps and heaps of eggs, so that can be like a rapidly increasing bloat. So your tummy starts to get really big really quickly, any shortness of breath, if you're not going to the toilet as much, anything like that. If that happens, we're obviously not doing any exercise and we're contacting our clinic or our hospital straight away.